Esmeralda, and I work at Justice for Our Neighbors. I do collaborate with Mert. So at Justice for Our Neighbors, we provide immigration legal services for free for our vulnerable community that is at or below the 200% poverty guideline. And we're volunteer-based. We're a very small but mighty team, and we have offices in Grand Rapids, Traverse City, Kalamazoo, and the Metro Detroit area, as well as we're part of a national network. And I'm a Department of Justice accredited representative, so I'm not an attorney, but I do practice immigration law. I am a legal representative, and I have the authority to be able to do that. So I'm very thankful for being privileged to be able to work with our immigrants in our community. Oh boy, where do we begin? 10 minutes, right? So there's so much going on in this world, but just a few things. I can't touch on everything. But one of the things that just came up last week, the president wants to bar immigration visas for applicants that do not have health insurance when they come into the United States. So basically, it's supposed to be effective on November 3rd. So the applicants will have to prove to consular officials that they will be covered by an approved health insurance within 30 days of entry into the United States. And some of the accepted health insurances are going to be employer-sponsored, family coverage plans, and unsubsidized individual health plans. So like Medicaid and Affordable Care Act will not qualify. There will be exceptions to those who are children of U.S. citizens who come in as unaccompanied minors, and those green card holders or permanent residents who are returning to the U.S. after being overseas for less than a year, as well as refugees and asylum seekers. And so this proclamation sidesteps the Congress and the executive branch, so there is not an opportunity for public comment. So as of right now, there is no particular form that folks will need to people will have to fill out. However, there is more than likely there are going to be some challenges, in the court for this unfortunate news. And so this would affect about 500,000 people seeking green cards from abroad. Which the majority of them will be like parents and spouses of U.S. citizens. So that's that. Another note, along the Mexico border, it's been almost 1 million arrests during the fiscal year 2019, so from October to September 30 this year. That's been an increase of 88% and the highest since 2007. And in September alone, there was 52,000 migrants were taken into custody at the U.S. Port of Entries, which is a decline from 18% from August. And the majority are Central American parents with children who stated that they had fear coming in or going back home, so that they want to seek, for instance, asylum. Versus before, it was mostly single adults from Mexico who could be quickly processed and deported back. So that's kind of like why there's so much backlog and whatnot at the border seeking asylum. And unfortunately, smuggling organizations are taking advantage of this because for those folks that come in, like a mom and a child, children can only be detained for so long, so then they're going to release them out into the U.S. somewhere. The parent will also go with, and then what happens with those families? They tend to be smuggled, or they're promised to, have jobs and whatnot. And Michigan is a high traffic area for the vulnerable population. Also, along with that, the president, to try to, crack down on all the asylum seekers, they imposed the tariffs, and the Mexican president sent out national guard troops to halt the Central America migrants, and then expanded a program that requires migrants to way outside the United States while the legal claims are processed. So you can just imagine living outside, trying to, get legal counsel. How is that even gonna work? And as it is, our immigration system is so complex. So he has a program going on of migrant protection protocols. So nearly 50,000 have been returned to Mexico. And then, they're living where, right? They're waiting months for, in dangerous border cities. And again, it's being challenged in the federal courts. However, unfortunately, while it's still litigation, they're able to do it. So folks have to stay outside the United States. And then just some local news regarding our refugees. So Michigan is recognized as one of the most welcoming states in the country. Governor Whitmer opposed the administration's plan to reduce the number of refugees for the U.S. resettlement. On September 26th, the White House released the presidential determination for refugee resettlement for fiscal year 2020. Right now it's 30,000, it will be 18,000. In previous years, it was between 75,000 to 95,000. So there are about 70 million forcibly displaced individuals worldwide. And on top of that, White House also released an executive order called Enhancing State and Local Involvement in Refugee Resettlement, with the intent of expanding the authority of state and local jurisdictions to decide to resettle refugees in their states and communities. The executive order states that if a state or locality has not provided consent to receive refugees under the program, the refugees should not be settled within that state or locality. That's what's happening, just many unfortunate things. There's always a possibility to provide public comments on the regulations.gov website, and I encourage everybody to do that. For immigrants, it's just a really tough time right now. So, yeah. Anybody have any questions?
No, but a comment would be to vote Democratic.
So if you're not a U.S. citizen, make sure you apply and get the voting privilege that we should have as U.S. citizens, and make sure that we exercise that.
Can we have a little discussion on that?
Yeah, absolutely.
Because have you ever seen anyone, this reminds me of Nazi Germany. And that the democracy is being demolished just by the will of one person. And I don't know why he's picking on us, but instead of an invasion, we should use it as an infusion, because just the carp problem in the Mississippi River could be a short-term solution for all these people. The state of Illinois and the state of Kentucky are paying $100 per fish caught, and we should be able to plant all these migrants along the Mississippi River and have them fish and pay them so that if they do return to their home, they'll have money in their pocket. And these fish will not invade the Great Lakes.
Alright, well, thank you very much. Thank you, Esmeralda. Let's give Esmeralda a big round of applause. My name is Veronica Quintino Aranda, and I'm part of the steering committee for the LCC. Today, I also work, well, every day I also work it's a collaboration between Alzheimer's Association and Michigan State University Research Center, and we are McFAD, Michigan Contextual Factors, and we've been hearing the voice of the community. And for the past year, we've been talking about signs and symptoms of Alzheimer's, how we can have a healthy brain, but we've also been listening to your voice. And one of the topics that the community wanted to listen to is, if you're a caregiver, like how can we care for somebody, but also care for ourselves? So today, doubly supervised, my two supervisors are here, so I'm on my best behavior today. And they're gonna be our guest speakers for today. So I would like to welcome Joy Small from the Alzheimer's Association and Dr. Irving Vega from Michigan State University Research Center.
Thank you, Veronica. I want to echo what Sergio said at the beginning, and thanks Salta for hosting us today here. There's some construction that is going on in the Grand Rapids Research Center and it's supposed to take over the parking lot, so that's why we couldn't do it there. And then Salta helped jump in and say, yeah, we have a space, so they are, and the work that they do in the community is something that we need to support. They need our support, our encouragement, and just when you pass by, just say thank you because they're doing a great job in the community. And also LCC, it's always been a very good partner with us, bringing up information to the community, and that's what this research work that I do with the community is possible. Creating that partnership with the community to bring information on a disease that is affecting everyone in the United States, mostly, but in particular to the Latino community. Latinos, we are more risk of developing Alzheimer's disease than any other ethnic group. And the prevalence of Alzheimer's disease is higher among Latinos and African Americans than non-Hispanic whites. And hearing about the immigration report, it makes sense. It's all the disadvantage that we are imposed on us. Social determinants of health are actually the main driving factor that increase our risk of developing Alzheimer's disease. If you want to think about what are the things that increase my risk of developing Alzheimer's disease or dementia, is stress, social disengagement, poor childhood upbringing, less education, socioeconomic status, which lead to poor outcomes, health outcomes, like diabetes, cholesterol, hypertension, cardiovascular diseases, okay? All those together, every single one of those are risk factors for Alzheimer's disease and early dementia. And what we can do to reduce that risk is right there, is to provide better health, better education to us, better health services, and decrease the stress, this socio-political stress that we're living in our community. We can reduce, by doing that, we can reduce up to 50% of the numbers of Alzheimer's disease cases reported every year. What we need to do is to change the way we interact with each other and the way we try to go by every day. We help healthy living practices. And I don't do much of those, like exercise and sleep well, reduce the stress, be socially engaged, that we do a lot. But diet, all those aspects of healthy living will reduce the risk of developing Alzheimer's disease and dementia. And the program that we have, and the reason why we want to bring that information to the community is that we think that I would worry about that when I'm 65, 70 years old. The problem with that mentality or that misconception about the disease is that that's when the disease presents itself. It's when the symptoms become apparent, but not when the pathological process started. The pathological process starts 20 to 30 years before the clinical presentation. So if someone developed the disease around 65 years of age, that means that around 35, 40 years old, the pathological process started, okay? But I like to see Alzheimer's disease as a long life process that started when you are born. It is known that children that are born in a stressful environment and raised up in a stressful environment versus a kid that is in an enriched environment. That kid in an enriched environment has more connections in the brain than a kid that is born in a stressful situation. So that means that kid in an enriched environment has better tools to deal with any lesion that is in the brain, so that the clinical presentation of Alzheimer's disease, if appear, will take longer. And what you see is that the Latino community not only is a higher risk, but the disease presents itself earlier than whites. okay?